Hello, everybody. Welcome back to another episode of the Mindful Muscle Podcast with my fabulous co-host today, Jody. How are you doing?
I'm great, Gio. If you're new here, welcome. Gio and I are two individuals who went on health and wellness journeys separately and collectively have lost 140 pounds and have maintained that weight loss. Mindful Muscle is a podcast for the beginner. So if you are new to your journey or just starting out, or even if some months under your belt, like and subscribe and keep watching us for more tips and inspirational messages.
Well, thank you very much, Jody. Our next guest is a repeat guest, but she is a fighter. She just went through a serious surgery. And if you remember her, we talked about her type 1 diabetes and her fitness and her positive attitude. Maggie, welcome to the show. How are you today?
I'm doing great. How you guys doing?
Hey, tell us a little bit about what we spoke about the first time, your fitness, your type 1 diabetes, before we transition into this massive surgery that you had.
So I have been a type 1 diabetic since 1994 when I was 4 years old, so 30 years this year. When I was 15, I was also diagnosed with a hypertrophic cardiomyopathy. In 2020, after COVID hit, was when I kind of got the bug for fitness. Actually, Jodi had posted some before and after pictures. I saw it and something inside me snapped, and I was like, I want that. I want to have something like that where I want to improve myself. I wanted to look like Jodi, super fit, but it has completely transformed my life. I'd never thought about how it might affect my health conditions for the better. I promised myself I would just keep going when I didn't want to, and here we are 4 years later, still doing it.
Amen for that. Yes. What
Mhm.
went into your surgery? What was the condition that required for you to have this surgery?
So, like I said, I have it's called a hypertrophic cardiomyopathy, which it's a genetic condition. My father passed away from it when I was 13. It causes thickening of the heart muscle. That thickness can cause certain problems. Within that thickness, you can form scar tissue, and your heart beats because of electrical signals. So that scar tissue can form currents in your heart. Your heartbeat goes erratic and you can go into
Hmm.
cardiac arrest. So with the condition, you're at a higher risk of cardiac arrest. That happened to me when I was 32 in 2022. That happened. This surgery, while it's related to the condition, is kind of a different monster with the condition. The way that the location of the cardiomyopathy, it's the chamber of the heart, your left ventricle, where the heart
Hmm.
pumps blood out. Because of that thickness, it can cause an obstruction. That's what they call hypertrophic obstructive cardiomyopathy. Yearly, you go for testing and they take different measurements. In April, I had an echocardiogram and my cardiologist called me. I had always been told that surgery might be on the table at some point in my
Hmm.
future since I was 15. When he told me, the thickness had gotten to a point it was obstructing blood flow out of my heart. And even though it wasn't life threatening at that point, he wanted to do something. I'm at an age now where typically your heart physically kind of starts to change. So he was saying he wanted to act now and do something rather than waiting for it to get worse. So the surgery, it's called a septal myectomy, where they basically they crack you open, they
Of
go
course.
in, they cut a little nick in your aorta and then go down into your left ventricle. It was described to me like a snowplow, how they take away layers of that added muscle. It was something I always knew could be on the horizon. Talk first started in April. July 18th was the actual surgery. And that was actually a pretty quick turnaround because
Hmm.
I'm really annoying when I want to be. So I was kind of her whole team, like, let's do this. It's been a wild ride.
Hmm. So let me ask you, did you feel any symptoms as it was growing? Did you feel any fatigue, dizziness, anything like that?
So at the time, I met with a lot of specialists and they all asked me that question. I couldn't report any symptoms that I recognized as symptoms. Figure, I've been on a
Hmm.
beta blocker since I was 15. I see the doctor regularly. I was never into fitness before being diagnosed, so I didn't have much to compare it to. Once we started talking about it, I tried to be more aware of if I was experiencing symptoms, but it was really hard because anything that I thought might be a symptom, I'm chalking it up to, well, maybe I'm just paying attention to this. Since healing from the surgery at 6 weeks, I was cleared to start exercising. I've been walking almost every day since the surgery. Slowly, things were easier for me. Around 4 weeks, I spoke with my cardiologist on the phone and I was telling him that the day before I had done a half-hour walk where I was slowly increasing an incline. A year ago, walking on any type of incline, I'd be out of breath. I just kind of thought, well, I don't do a lot of cardio. I just walk on flat
Yeah.
ground or do the elliptical. So maybe I'm just not used to doing this. Ever since having the surgery, I've noticed a lot of things I can do now. I've been running for fun sometimes. That was just not on the table before. So I was definitely having some symptoms, but not recognizing it as symptoms.
I can tell you one of the symptoms is it messed with your brain because you said running for fun.
Like we
It's a,
adjust to feeling a certain way, and we might not be feeling our best selves, but we feel like it's normal until our body knows otherwise.
Yeah, a lot of people when they change from a, unhealthy diet, high process to actually eating healthier, they didn't realize how bad they felt until they're
Exactly.
in the new. I'm going to show a picture here of a scar that you have. Explain to the audience the profoundness of this scar and what we're looking at.
So this was while I was still in the hospital. I was trying to document as much as possible because something
Hmm.
major like this, it's easy to forget the little details. This was just maybe a day or two after the surgery. You can see from the top of my sternum a big line that goes down my chest, like where my bra would be. So
Hmm.
it's a good 6, 7 inches long. This was when it still looked pretty gnarly. You can see it's really red and looks kind of
Hmm.
not open, but it looks like a fresh wound. I've got a few pictures since then just documenting how it's changed and everything. It's almost surreal. I was
Hmm.
expecting staples or gross stitches or something, but it's like barely anything. It's kind of
Hmm.
cool looking. So that was the fresh incision. I think that may have been the day they took the bandage off of it.
And what's the thing connected to your heart?
That was some type of heart monitor. They had me hooked to so many different things. I had a heart monitor that I had to hold in my pocket for a few days. So that's just one of the electrodes from that.
Okay. And as you were going into the surgery, the day of, what was your mindset? Like, what were you thinking?
It was nerve wracking. I was lucky because I had to be at the hospital at 5 a.m. and I didn't really sleep much the night before. I was in go mode. When I'm nervous about something, I like to just not think about it, just go through it. I was excited to wake up again. I was excited to just have it done and over with. I'm not much of a catastrophizer, but it's a lot to think of. People have open heart surgery all the time. I know that as far as open heart surgery goes, this one is the best one to have. But still, for me, I couldn't stop thinking about the breathing tube. That really freaked me out. I had done so much research about the surgery and what the healing process was like and learned that they put you on a heart lung machine. It makes sense. They have to stop your heart so that they can do surgery on it. That was overwhelming for me. I had never experienced anything like that. So thinking about they're going to inject me with drugs to stop my heart was heavy. So I tried not to think
Mhm.
about it. I think I was pretty calm. I was at the Cleveland Clinic and they
Mhm.
were phenomenal. I talked to everybody. So, the hotel on the campus, every person I saw, I'm asking like, what are you here for? So I met some people that, they were in a lot worse shape than me. So it was nice to be surrounded by both my mom and my best friend Kim. Having them with me was calming, but also being surrounded by so many people who were in a similar boat. I've never been around so many people that could relate to what I was going through.
Mhm.
Mm. How long were you in the hospital?
Oh, this is like a brag point for me. They told me that I would they told me that I would be in the hospital for 6 days on average, and I left on day 4.
And why did they feel comfortable
Mhm.
releasing you?
I spent 2 days in the ICU. I don't like wearing hospital gowns and stuff like that. So even in the ICU, I put a bra on under the gown. I had put my underwear
Hmm.
on. By the time I got to a normal room, I was asking my mom, can you help me like put my clothes on? Like I don't want to wear this
Hmm.
anymore. So people kept coming in and, are you the patient? You don't even look like you need to be here. Ultimately, the last day I was there, I like to think that I annoyed them enough that they wanted to get rid of me. So the last day I was there, they had everybody on that floor. They were all heart surgery patients that had come from the ICU. So one thing that they had everybody doing, they wanted us walking as much as possible. So the whole wing was shaped like a circle, and I'm doing my laps. Like, what else am I going to do? Besides eat and
Hmm.
do laps. As I'm passing people, I'm like, hey, you guys want to race? I thought it was funny. Nobody else seemed to think it was funny, but I thought it was. But they had signs near the wing that I was in advertising a rooftop lounge. So I was asking, can I just walk up there? You walk out the door, there's an elevator and it brings you right up there. So they were telling me that I had to talk to the nurse practitioner and get her approval. So then I'm harassing the nurses every hour, like, well, where is she? Can I get that approval? I want to do something. I walked up and down a flight of stairs when nobody was looking because I wanted to know what stairs felt like. Eventually, by the time the nurse practitioner came in, she looked at me and she's like, do you want to leave? I want to go home so bad. So they said I was moving enough and eating well and adjusting
Mhm.
well. I didn't really ask questions about why they cut me loose. I was just glad to be gone.
It's their
You don't have
mine. I'm out of here.
exactly. You don't have to tell me twice. Here's
Yes.
another picture, right? This is
Hmm.
post-surgery.
Yep.
It's several weeks past surgery.
Yes.
You can tell in the picture that you're very fit. But before we talk about your fitness post-surgery, how do you think your fitness pre-surgery helped you recover and be able to go through the surgery?
I think it was like night and day. The fact that I left early, I'm like Murphy's Law. Not only do I have the heart condition they have to monitor, but I'm also a type 1 diabetic. And it's really
Hmm.
hard to maintain control of your blood sugars in the hospital. I didn't have my insulin pump for a solid 24, 30 hours or so. So I was figuring that I would have more complications than the average person. I've talked to so many people in a Facebook group who have had the same condition, and almost everybody has had some level of complications or extreme pain. I was already so used to moving and trying to help my body run as efficiently as possible. I think that my entire experience can be blamed on fitness and nutrition, and that, I take care of my
Hmm.
body from the inside out. It's a true testament to it. I can't stop preaching it to people. I'm a prime example of why you should do this, because it's not just
Hmm.
about what you look like. My body was healthier from the inside than probably most of the people they saw that day.
No, it's so important. Not everybody's going to have the type of surgery you had, but you think of women in pregnancy, right? A lot of
Mm-hmm.
them are told to just stay in your bed and don't move, where that's not the best in order. Obviously, if there's a specific condition why you have
Yes.
to, but otherwise, you see other women still lifting way into their pregnancy, and I think that helps with delivery. Part of the reason I work out is you don't know what you're going to face in the future.
Yeah.
I would rather be as healthy as that can be to survive anything, an accident, or, in your case, open heart surgery. It's commendable how, even though you knew this might be in the future, you didn't let it stop you from taking care of yourself before it actually happened.
Yep. I actually sort of aided some of the doctors and nursing staff in my care. Since I'm a type 1 diabetic, anytime I've been in a hospital, they automatically put you on a diabetic diet. So the food that I was allowed to order was restricted. They couldn't tell me how many carbs I was restricted to. I was trying to
Mhm.
explain to them, I could tell you my exact macros. I could tell you exactly what I should be eating. When I wanted this fruit parfait that they had on the menu, my mom's gonna laugh when she sees that, because we kept talking about, why wouldn't they let me have this? The second day in the hospital, when I woke up and I was able to eat that day, one of the meals they gave me, the protein was a shelled hard boiled egg. I'm like, they should have at least asked if I wanted this. Like, that's
Mhm.
disrespectful. So at that point, my mom and I both decided, we'll take over the food and everything. And I did end up getting my fruit parfait, and I didn't even
Mhm.
eat all of it. So I'm like, give me half a serving.
That's kind
So,
of disturbing that they aren't knowledgeable with nutrition and diabetes enough. Hey,
You,
this person's been living with type 1 diabetes
yep.
for, most of their life. Maybe they know what they can and cannot have.
You would be really surprised. It's nothing against hospital staff, but it's really difficult to maintain someone else's blood sugars. Everyone's dosages and their carb ratios, and
mhm.
it's different for everyone how a unit of insulin is going to affect your blood sugars or cover carbs and things like that. So they have to just kind of follow as best as they can. Typically, if a hospital is treating a type 1 diabetic, they put you on an insulin drip. So it's just a drip of constant insulin. I wasn't really fighting about the diet thing at first because I didn't have my insulin pump on, but it got a little frustrating when I asked them. I went to take my insulin and asked, how many carbs are on this plate? Nobody knew. So I'm like, all right, thanks for the diabetes diet, but nobody knows what I need to know.
Yeah, Jody, you brought up the fact I've been walking in the morning listening to audiobooks, and in the last like couple of weeks I've listened to four. And there's always a chapter on diabetes, and everybody's so different. You can have two people on type 2 diabetes, and just the way they respond on things. These are books are mainly on type 2 diabetes. Type 1
Hmm.
is a little bit different. It's a constant reminder that they do not teach nutrition in medical school. My wife is a medical doctor, and all the nutrition she's learned has been on her own. And so they need to pay more attention to, especially someone like you who went in fit, who is already showing positive signs. You know your body. And
Yep.
so doctors need to be able to listen more.
Gave the team a hard time. I had to meet with their
Hmm.
endocrinologist, and I didn't like the way he was approaching me at first. He was kind of preaching blood sugars to me. And so it was irritating because the things that he was saying were kind of misleading. He was implying that type 1 diabetics can avoid blood sugar fluctuations, which yeah, in a perfect world, but it doesn't work that way. If anything that can
Yeah.
affect your mood can affect your blood sugar. Sometimes things are
Hmm.
beyond your control. I asked him how long he had been in the medical field, and he said 15 years. So I reminded him that I've been a type 1 diabetic for twice as long. And then the anesthesia and everything, I have concerns about anytime I've been put under sedation, it
Hmm.
drastically lowers my blood sugar. Different people react to it differently. So I was really scared of being put under for about 6 hours without someone checking my blood sugar constantly. He explained some of the medication they use to stop your heart actually spikes your blood sugar,
Hmm.
which made me feel a little bit better because then I was like, okay, they're going to have me on an insulin drip. And then I requested that they checked my blood sugar every like 20 minutes while I was under, and they said they could accommodate that. So that was great.
And so you did mention 6 hours. Was that the length of the surgery?
So they told me that from the time you get wheeled back until the time everything is done, it's about 6 hours. The surgery
Hmm.
itself takes maybe an hour. This surgeon, Dr. Smedera at the Cleveland Clinic, they said he probably does it in like 45 minutes because he's the best. He's wonderful. I cannot say enough great things about Dr. Smedera at the Cleveland Clinic. He was fantastic. Apparently, I tried to rip out my breathing tube. So I woke up close to 10:30 at night. I thought it was daytime. I was like, "Oh wow, that was like a couple hours. That was great." And then it was
Yeah.
nighttime. My mom and my best friend had gone back to the hotel.
Let me show some pictures here, and I want to ask about these pictures. You showing some September 11th to
Mhm.
October. What are some of the things you'd like to point out, and how are you feeling physically and mentally in between these two shots?
Sure. The picture from September 11th, that was my first week. I hired a new coach to help me get back on track. That was the week after I had gotten the go ahead to start working out again. I wanted to have a solid week to toy around with different exercises at the gym and figure out,
Mm.
what like I couldn't do bench press for a while because, it's still I'm pretty sore after doing that even still,
Mm.
but I wanted to get a feel for how I was going to react to everything before I dove in. September 11th was my first check-in photo with my coach. Then October 1st, a couple weeks later, every week I do these photo check-ins. I see major differences in my body. I don't know if other people
Mhm.
would notice all of it, but I know anytime I gain any weight, if I lose any weight, I'm very clued into what I look like. To me, it was just kind of interesting. It was phenomenal how I had heard things about muscle memory. I was trying to be really graceful to myself that if I couldn't exercise for 6 weeks, I need to give myself at least that long to get back to where I was. But this is a matter of weeks, and the changes are already so different. So I'm still in the healing process. I've got technically
Mhm.
a week from today would be the full 3 months, 12 weeks, fully healed sternum and everything. But yeah, I didn't expect to see progress so fast. It's been significant to me to see these changes every week already and kind of get back to where I was and where I want to be.
I definitely
No.
see a difference between the 2
Mhm.
definition-wise and
Mhm.
inches-wise, but we are our own worst critic, and the
Oh,
fact
yes.
that you can see it,
Yep.
I mean,
Mhm.
that's huge
Yep.
because a lot of times people will have inches difference and they'll be like, "I don't see any difference," and
Yep.
everybody around will be like, "What is wrong with you? There's definitely a
Mhm.
difference." You see a difference.
Yes.
So, that's
Yeah.
incredible.
As far as how I'm feeling, it took me a little bit of time to recognize that after surgery, I wouldn't say I went into a depression or a pity
Mhm.
party, but fitness and nutrition have become so crucial for my mental health that it was really hard for me. Even though I had mentally prepped myself and I had told myself, I'm gonna be easy on myself. I'm not gonna stress about it. But during the healing process, when I could only walk a little bit at a time, I wasn't really eating as much as I would, just because if I'm not tracking it, I kind of lose sight of, oh, I didn't eat all day or whatever. I was still
Hmm.
eating, but not as much protein as I'm used to. I told myself I was going to ease up on the tracking, like I wasn't going to stress about it. But you do that for a few weeks and then you really start to feel the changes. I thrive with a routine. I really like having my routine.
Hmm.
The way that I eat, the way I exercise, it's all part of that. I eat the same things every day because I know what it's going to do to my blood sugars. I know what it's going to do for my energy levels. I feel like I'm finally crawling out of a hole, if that makes any sense. I
Hmm.
wasn't in some like deep, dark place, but I didn't feel like myself. And I was really antsy to get back to my norm. I feel like I'm finally starting to get back to normal, better than normal, honestly, because I can do more now.
Look, I'm glad you're sharing that because a lot of people sometimes think it's always 100% hunky dory, that
Mm-hmm.
everything is always great and you're in the gym feeling happy. Like today, I had a great workout and I posted it on Fitbot, but not every day is like that. Otherwise, I'd be posting every day, right?
Yep.
It's good to hear. You just went through a major surgery and
Yep.
it's okay to not feel 100% through it. People have to understand you're going to go through things, but it's not, don't beat yourself up when you go through things. Just
Yep.
make sure, keep going steady, and you've climbed out of it. What are you most looking forward to as you are now, getting close to that 3 month window post
Yep.
surgery? And now that you feel better heart wise,
Mm-hmm.
you're running for fun. That's crazy. But things like that, what are you most looking forward to as you go forward?
One thing that I'm really excited for is every year there's a turkey trot nearby.
Hmm.
And I've done it for a couple of years. It's like a walk run. In previous years, I've mostly walked. Last year, I was behind a woman. She had a shirt on that said "blind participant," and I'm like, I got beat. She did great. I shouldn't even be mentioning the fact she's blind because clearly it didn't stop her, But I'm like, okay, I got smoked by the blind woman on a 5K. Like, okay, good, that's great. I'm really excited to do that again this year and compare. Every year I've done it, my time has gotten shorter and shorter. I'm really excited, not even as a competitive thing, but I feel like I'm finally getting to see things that I felt I should have been capable of. And I didn't feel like I was being held back, but now I realize, like, holy crap, I was held back. So like there's so
Hmm.
many things that like on my leg days now, I do cycling beforehand as fast as I can for 20 minutes. I can push myself in ways I never thought I could. So there's all these different outlets as far as fitness that I have now that I don't even know what they all are. I was joking the other day to someone about oh, maybe I'll do CrossFit with Jodi now that my
I
heart's
was
not going to fall apart.
See, the surgery affected more than she's running for fun. Now she's talking about CrossFit. Oh man. We're gonna wrap up here in a bit. I have three daughters. You have a daughter. How was her attitude? Mommy's going under a major surgery. How'd you guys navigate that together?
So I like to be as honest as possible with my kids. My son is
Mm-hmm.
much older than my daughter, so him I was able to be very honest about what was going to happen and that I didn't want him to worry about it. My daughter, I was scared. I mean, she's like my mini me, so I was kind of
Mm-hmm.
scared about is she going to be jumping on me or could I get hurt with by her but without her meaning to. So I explained that I was going to go to the doctors for a while and when I got back we'd have to be careful. She was great. She kind of treated me like I was made of glass at first. She was kind of scared to hug me, but I showed her my scar and she thought that was pretty cool. I actually have pictures of my open chest in the middle of surgery. I,
Oh.
I specifically asked for that. Both my kids, if they wanted to see it. She's 4, so she's not really
Hmm.
creeped out by stuff like that. I don't think she
Yeah.
fully understands what it is. My son wanted no part of it. He didn't want to see it. Um, but yeah, little victories. I couldn't pick her up at first. I couldn't
Hmm.
lift more than 5 pounds. She was my measurement for can I load plates at the gym yet? Because she weighs 46
Hmm.
pounds. I'm like, when I can
Hmm.
comfortably lift her, I can comfortably lift plates. The first time I tried to lift her, I picked her up. I was able to hold her for a couple seconds and I had to put her down. Then, like a week later, we try again. When I was able to get her out of the tub, put her in her towel, and then pick her up and
Hmm.
carry her to the other room to get dressed, she was like, "You can pick me up for a long time now." So she and I never focused on the negatives of what I can't
Hmm.
do. She's so great at, we'll just celebrate the victories.
Yes, that's awesome. Somebody on Fitbot, I think on Sunday, asked me, "What are you training for?" And I was like, life.
Exactly.
You
Mhm,
know,
that's my
I have a
answer.
9,
Yep.
6, 3-year-old. I want to be there for them as
Yep.
long as I can be. I see you post pictures of your daughter, and that's why I asked. The worst thing I think of is something happening to my wife
Hmm.
because they're so close to her. I would
Yep.
rather something happen to me, and mothers and daughters are a tight bond, and mothers and their children, period. I'm glad you're past that. What does the future hold for Maggie? Now you've been through something this major. What do you want to
Yeah.
accomplish?
That's a good question. I don't really know that I've gotten to a point yet where I even know what I could accomplish. I love pushing myself. I like finding my limits. Sometimes that means going a little bit beyond it and then learning there's a limit there. As time goes on, things that were a limit, at this point, it's still weekly. Like something that
Hmm.
was maybe too painful last week, I can do this week. It's been so awesome getting to see how things are getting easier. Even this program I'm doing, I'm almost pushing the same weight that I was before surgery, but I'm doing
Hmm.
more reps. This program I'm doing now, it's lower weight, higher reps. The
Hmm.
weights I'm using are so similar to what I was using before, but I can do more reps. I thought I was super fit before. I can't wait to see what I can do.
This might take us till the very end, and it might be a little upsetting, but I think it's important that we talk about it. Recently, you've heard something that I know Gio and I have individually heard, the words, "You are lucky."
Yep.
Mm.
Tell us how that makes you feel. I can tell you how it makes me
Right.
feel when I hear it, but
So normally when I hear something like that, I take it as a compliment. It reads to me like maybe I make it look easy. Maybe people think that, oh, if
Hmm.
I was just like her, then I could have that or whatever. This particular time that I told you about was especially frustrating because it was said in a group of people that have the same condition. I was just sharing my progress photos in there. It's a wonderful group. Everybody in there is great. Sharing my progress photos. And I've been talking about this surgery for months now. So everybody knows when I mentioned it in my post. All of the other comments were super supportive. You're doing great. Oh, that's awesome. The one person that said, oh, you're so lucky. I gained weight after my surgery, and I'm like, well, I wouldn't really call it luck. I worked really hard for that, and then she's telling
Hmm.
me, well, I have hormonal problems. And I'm like, yeah, same. Like I have type 1 diabetes, I have Hashimoto's, I have hypothyroid,
Hmm.
and I'm not downplaying her struggles because,
Yeah.
she did explain some of her hormonal problems and they're different, but it's frustrating to me because I'm not without empathy, but it is just an excuse to look at someone else and
Hmm.
say, oh, well, you're so lucky. You're so lucky that you were able to lose weight. That's what she told me. You're so lucky that you're able to exercise and your body allows that. I'm like, yeah, my body fights against it every single day. I certainly think that I'm more fortunate than a lot of people, but I also think that there are people who are more fortunate than me. So I don't chalk it up to luck. I think if anything is lucky, I think that I'm lucky to have the kind of mental capacity that I do to push
Hmm.
through things. If I see a roadblock, it's like a challenge to me. If I'm told I can't
Hmm.
do something, I want to do it. That's why I say I'm running for fun because I could never actually go for a run before.
Hmm.
So that I think I'm very fortunate that I have a good mindset for it. But to say that my fitness progress, I'm so lucky. It kind of takes away from all the effort that people put in because it's constant. You're making an investment in your future self, and you have to keep making those investments every day. You can't just have one good workout and then have biceps or something. It
Hmm.
has to be constant. And I think that people who have been there, they understand that have these challenges or roadblocks or you can overcome it. I mean, I've said for years, even if you've got no legs, you can still dance in a chair. I've seen a guy at
Hmm.
Planet Fitness in a wheelchair with no legs using his arms to lift himself up into some of the arm machines. So you
Hmm.
don't have to let it stop you. But yeah, I've definitely rubbed people the wrong way before by explaining that's you're making excuses. People do that. I understand it. I made excuses for years, but if you're not going to call it what it is, you're not going to see any change. We don't see changes if we stay in our comfort zones.
I like
what
how.
luck to
Go ahead.
me is something positive that comes out of something not in your control.
Hmm.
Hmm.
How much you've worked on your health and fitness, that's discipline, that's
Yep.
consistency, that's grit, and that is the ultimate definition of self-love.
Yep.
When you call something that is actually hard work and self-love luck, you're just staying in your own way. It's
Exactly.
like a lot of us will say we want something, but we're not if we're honest with ourselves, we don't always wanna put in the work that it involves. So we'll say
Yep.
luck
Hmm.
so we can have an excuse to not go after it.
Yep.
Well, no, it takes hard work. If you want it, you have to go after it.
And I, for years, would say, well, I wish I could exercise, but I can't because I have a heart condition. I wish I could diet, but I'm a type 1 diabetic. It doesn't make any sense because, of course, you
Hmm.
can do those things. I might have certain restrictions. I got to bring juice boxes to the gym, or I have to be aware of how does my heart feel? I can't go sprinting for 10 miles and get my heart rate up to like 200 or whatever. But, so I have certain limits, but you learn what those limits are and you work around it.
And look, from seeing your workout pictures, no one, unless they knew, can tell you have any of these conditions, right? And so for them to say it's luck, no, once you ask first, what are you doing? And
Mm-hmm.
then when you find out what she's doing on top of all her setbacks, Hashimoto's, the heart condition, type 1 diabetic, then you should sit at her feet and learn. Because all of us, the three of us here, come from three different backgrounds. I could never wake up at 3 in the morning to work out, but I'm up at 5:30 and I've worked out at 11 p.m. Whatever it takes, you have
Yep.
to do. But too many people need it to be 100% perfect. If it was 100% perfect, none of us would really work out.
Yep. And if
Mhm.
it was easy, everybody would look like the Hulk.
Mhm. Maggie, once again, thank you very much. Sharing what you've been through is amazing. Surgery like that to now be back pumping iron, lifting weights,
Yep.
doing more reps than you did before, feeling healthier because you can now tell the difference from that obstruction. You're an inspiration to me, to Jody, to the rest of the Fitbot family, and to others listening. Thank you very much.
Thank you so much, you guys.
Until next time on the Mindful Muscle podcast, be blessed, and we'll hear from Maggie in the future. Take
I'll
care.
be
Bye
here.
bye.
Bye.